This is a 2-year-old child diagnosed with aqueductal stenosis. You can see the dilated third and lateral ventricles. We put in an endoscope through the burr hole in the right frontal region at the coccus point. After entering the ventricles, we inspect the ventricles. You can see the septum pellucidum was thinned out, and we are directly entering the third ventricle. You can note the two mammillary bodies with basilar artery and its bifurcation in front of it. I have a small window between the optic chiasma and the mammillary bodies, between which I can try to create an opening. I am creating an opening using a bipolar probe, making sure not to turn the bipolar on. Just using the tip of the probe, I will try to create an opening in the liquid membrane. You can see the opening has been created, and fine pulsations are seen in the base of the third ventricle. Through this opening, we will try to put in a Fogarty catheter. The Fogarty is navigated through the liquid membrane, making sure not to cause any rupture of the vessels. The Fogarty catheter balloon is inflated with 1 ml of saline, and you can see the dilated opening that has been created in the liquid membrane and in the floor of the third ventricle. I have changed the catheter because the previous catheter balloon was burst. Hence we use saline while inflating the Fogarty catheter balloon. You can see the fine perforators of the basilar artery. Now I have navigated the catheter into the both the layers of the liquid membrane, and I am trying to inflate the balloon. While inflating, we try to retract the inflated balloon so as to enlarge the size of the opening. I am satisfied with this opening, with the size of the opening, and yes, you can see both the membranes have been adequately opened, and you can see very fine pulsations of the CSF going through the third ventricle. So this is the end of the procedure. Now we'll withdraw the camera and we'll also inspect for any bleeding. This is our operative setup. I stand on the left side while my assistant stands on the right side. It is important for assistant to hold the elbow of my catheter and my endoscopic system so as there is no sudden jerk while I am moving through the scope. This is the post-op scan. Thank you.